Heart attack. I made this presentation specifically for those viewers who may not have any idea what this means exactly. It is very important that we understand the blood supply of the heart before we go into the topic itself. Alright, the first thing you'll need to keep in mind always is that heart is a muscle. And it needs oxygen and nourishment like any other tissue in the human body. This nourishment is provided by a meshwork of blood vessels that sit on the outside of the heart, and these are called the coronary arteries. There are two major coronary arteries. Now if you look to the image on the left hand side of this slide, you will see the heart image with blood vessels coursing on the outside, and these blood vessels, the main ones are the left main coronary artery and the right coronary artery. The left main coronary artery supplies, as you can see from the name, the left side of the heart, and the right coronary artery the right side. These blood vessels then divide into smaller branches and even smaller branches which are spread out over the entire heart muscle, supplying the necessary nutrients and oxygen to the tissue. If any of the following risk factors apply to you, then your chances of having heart disease and therefore a heart attack are quite high. Do you have high BP or high cholesterol with the following pattern: high bad cholesterol and triglyceride level with low HDL cholesterol? Do you have diabetes? Do you have uncontrolled diabetes? Do you smoke? Do you use any illegal drugs? Do you drink alcohol excessively? Are you obese or overweight? Do you eat an unhealthy diet? And is your lifestyle sedentary? Do you exercise very little? Do you have a lot of stress in your life? Is there any family history of heart disease, such as a parent or a sibling having had a heart attack at a young age? If you have one or more of these risk factors, then certainly it increases your likelihood of having heart disease. And one important thing to keep in mind while you're looking at the screen is that most of these risk factors, except maybe for the last one, are modifiable, meaning there are things that you can do to your lifestyle which will help improve these conditions or eliminate them altogether and help therefore improve the functioning of your heart. Now the initial stage of heart disease causing symptoms, we call it angina. What exactly happens here? If you have one or more risk factors that we just elaborated, there's going to be a gradual buildup of fatty deposits and cholesterol. This material that gets deposited in the blood vessels is called plaque. This material will slowly start building up in the inside of the coronary arteries, and the buildup typically starts at an early age. Now, as you can imagine, if the risk factors are not really taken care of, then over the years this plaque buildup will only keep increasing and slowly start blocking the blood flow. This is what is going to lead to the development of chest pain or tightness, also known as angina. Initially, angina occurs when the heart muscle oxygen demand goes up. For example, when you exercise. Of course, your heart needs more oxygen. It is a muscle. It will need more oxygen, more nourishment when you are exercising. Also, when you are under a significant amount of stress, the oxygen demand also goes up. So when there is plaque buildup and this plaque is causing obstruction of the flow of blood, with increased oxygen demand, the blood flow is not able to keep up and in turn leads to the development of symptoms. Now if it's not treated, if it's not identified and treated at the right time, this angina can progress to the point where it's occurring even at rest. This of course is going to significantly limit the functional capacity of an individual, obviously, because that person may or may not be able to perform many activities that we take for granted. Here's a comparison between a normal artery, a normal calibered blood vessel with blood flow being very smooth without any sort of blockages inside, and on the bottom blood vessel that actually has a significant amount of plaque buildup, reducing the caliber of the vessel, now causing limitation to the flow of blood. As everyone knows, heart attack is always a sudden event. What happens exactly when someone has a heart attack? We talked about plaque. This plaque that has been building up in the coronary arteries, and keep in mind it doesn't have to be the main coronary arteries, it can be in the smaller branches of these coronary arteries that this plaque can build up. It can even be in multiple blood vessels happening simultaneously. So this plaque that's been building up, it can become unstable at some point in time and break. Now when it breaks loose, the surface on the inner side of the blood vessel becomes rough, and the body will mount a defense response against this reaction, leading to the formation of a blood clot. Now this blood clot will actually, it could completely block the flow of blood downstream, leading to complete loss of blood flow and loss of nourishment and oxygen supply to a portion of the heart muscle that blood vessel is supplying. That is what is a heart attack. If the blood flow to that portion of the heart muscle is not restored in a timely manner, it actually can become permanently damaged, or there can be death of that portion of the heart muscle. In these pictures, you see on the right hand side an image showing a plaque within the artery and a blood clot that has formed on top of the rough surface of the plaque, and as you can see, it is blocking the blood vessel completely at that point, which of course would mean that the blood supply will be completely cut off to the portion of the tissue that this blood vessel is supplying. All right, in the left top corner you see an image of the heart having suffered damage, shown in red, from blockage to the blood flow to one of the vessels. What are the symptoms of a heart attack? Most people know that heart attack means chest pain. This chest pain can be in the middle of the chest or on the left side. It's typically described as a crushing, stabbing, squeezing, burning type pain, sometimes pressure sensation. This can be associated with pain in the jaw, left or right arm, left or right shoulder. Now keep in mind that sometimes you may just have the jaw pain or arm pain without having any chest pain also. Heart attack can also manifest itself as a pain in the upper stomach, as shortness of breath, associated with profuse sweating, and typically the symptoms will last more than a few minutes, sometimes 3 to 4 minutes or longer. What are the immediate steps that will need to be taken? If you think you or a family member is having a heart attack, what you will need to do is to alert the emergency service first off, meaning call the local area ambulance service such as 108 in many areas across India. Call them right away. If for some reason you are unable to access ambulance service, you will need to rush to the emergency department of the nearest well-equipped hospital immediately. If you have access to aspirin, chew an aspirin 325 mg tablet immediately. And I say chew, not swallow. Keep in mind that if you've had an allergic reaction to aspirin in the past, if you've had any stomach problems with aspirin in the past, you obviously should not follow this step. If you do have a history of heart disease and you've been advised by your doctor to take certain medications when you have such symptoms, go ahead and do so immediately and go to the nearest hospital. Keep in mind that time is of essence. Do not delay treatment. What are the subsequent steps that are taken once you reach the hospital? The diagnosis of a heart attack is made by the physician in the emergency department on the basis of your symptoms, ECG changes. Keep in mind that sometimes there may not be any ECG changes, and also upon the blood tests to detect heart muscle injury, as well as other tests based upon the need. Treatment can involve any of the following: medicines to dissolve the clot, medicines plus angiogram, medicines with followed by an angiogram and angioplasty, medicines, angiogram, angioplasty with stent placement, and lastly bypass surgery. I've touched upon some of the procedures of that are done for a heart attack in the topic heart procedures. You may want to see that to get more information. Thanks for watching.